Hello, everyone. Good afternoon, and welcome to our live section. Thank you so much for joining us today. My name is Loretta Ngwebesibel, and I'm truly excited to have you here with us today for our weekly life conversation. So, today we're talking about something very important but not always discussed enough. So, the topic for today is postpartum recovery, the physical and emotional healing after childbirth. Now, many people focus on pregnancy and delivery, but the journey after birth is just as important. A mother's body, a mind, and emotions go through a lot, and she deserves care, support, rest, and understanding. So, before we bring our guests in, I just want us to really understand why this conversation is important. When a woman gives birth, everyone celebrates the baby, and that's beautiful. But many times, the mother is expected to immediately become strong again, start receiving visitors, doing house chores, caring for the baby, and acting like everything is normal. But the truth is, her body has gone through a major transformation. So, for the physical parts, she may be healing from vaginal delivery or C-section, from blood loss, from hormonal changes, breastfulness and breastfeeding challenges, from sleep deprivation, and sometimes pain and discomfort. And emotionally, everything changes, and that may be our routine changes, our body image may change, our confidence may change, and our rest pattern changes as well. And for some women, this is also the time they silently struggle with feeling overwhelmed, anxiety, unexpected sadness, or even feeling guilty for not being strong enough. So, postpartum recovery is not just about telling a woman well done and moving on, it is about continuous care, support, proper nutrition, adequate rest, mental and emotional check-ins, and access to health care when needed. So this period is very sensitive, and the way a woman is treated during this time can affect her long-term health and even her relationship with the baby. So that is why conversations like this are very important, and not just for mothers, but for the husbands, mothers-in-laws, sisters, friends, healthcare workers, and community at large. So because when a woman is well, the baby is well, and when both are well, the family is stronger. So to help us understand this better from a professional and practical point of view, Vivian's advocate, passionate about improving the well-being of women and newborns. She holds a master's degree in public health and is the founder of Advanced Women and Kids Health Advocacy Network, where she provides evidence-based education on safe motherhood, postpartum recovery, breastfeeding, mental health, and holistic maternal care. Our work focuses on empowering women and families with practical knowledge and support so that no mother feels alone, uninformed, or unsupported at any stage of her journey. Thank you so much, Ambassador Vivian, for joining us today.
Thank you very much. Thank you for having me.
You're welcome, ma. So,
Thank you.
today we'll be talking about. Can you hear me?
I
Okay,
can
so we're
hear you.
talking about what really happens. Okay, man. So we're talking about what really happens to a woman's body after birth. That is the emotional changes, the warning signs to look out for, how families and communities can support new mothers. So please stay with us. For our viewers, please stay with us. Drop your questions in the comment section, and let's learn together. So, my question goes like this. Hmm? Okay. Can you hear me, ma?
Yes, I can hear you.
Okay, all right, ma. So I have some few questions to ask, ma.
Go ahead.
Okay. So my number one question, what does postpartum recovery really mean, and how long does it take? What does postpartum recovery really mean, and how often does it take?
Okay. Thank you for that question.
You're welcome, ma.
In, in medical, we understand that postpartum is a period after delivery, that is after childbirth, and it, it can also be simply defined as a period a woman is going back to her pregnancy stage. Is that clear? So it can be physically, emotionally, and otherwise. Categorically, postpartum recovery can be from 8 weeks, that is 2 months. Then, but the recovery is quite different from each woman. So it looks at let's just look at it as pregnancy. When some women are pregnant, you notice some in their early first month, that is early first trimester, they are not, you won't even know that they are pregnant. Maybe as they are approaching like 4 months, 5 months before you notice. But some, immediately they are pregnant, they've already started, showing some signs of sickness,
Okay,
this
I can
and
hear
that.
you.
You can hear me? So that is it. So the recovering is quite different from every woman. So it is good that we allow postpartum mothers to heal and recover naturally. Thank you.
Oh, thank you so much, ma, for that explanation. I really like that you mentioned the recovery. Okay, so though it's a gradual process, because many women feel pressure to bounce back quickly, but healing takes time, and every mother's journey is different. So the most important thing is giving the body and mind the patience they deserve. So, my for the next question, what are the common physical changes women experience after delivery? What are the common physical changes women experience after delivery?
Okay. Thank you. A whole lot. Some women, not even some. Every woman that passed through delivery must experience a lot. When I mean it can be temporal, it can be long term changes like tummy changes, breast changes, hair loss,
Yes,
stretch marks, skin color,
even
skin tags,
bleeding.
yes, bleeding, and so. Then some after 3 months of delivery, they started adding weight. Then some you see them their size of shoe will now change. Someone that is putting on like 40 after delivering and after the person will now start wearing like 42 and so. So all these things are physical changes a postpartum mom can quickly notice. Thank you.
Okay, thank you so much, ma, for that wonderful contribution. Um, like you said, things like body pain, bleeding, breast changes, and fatigue are actually normal parts of recovery. So it helps mothers to know this so they don't feel scared or think something is wrong with them. So thank you so much, ma. For my question number three, what emotional or mental health changes can happen after childbirth?
Thank you. A low cause, a low in fact, mental changes are a whole cause. It comes with depression. You must have heard about postpartum depression. The woman
Yes,
feels sad, yet she can't really explain why she's crying. Some of them, when you go to visit them, you notice that they are not happy. You might ask them what is the issue. They can't even explain. So it's depression.
that
But
they're having this mood
yes, at a
swings.
particular stage, they
Uh,
yes, they pass through. Then some with baby blues, some you see them crying off to. Like you won't even know what is wrong with them. Then some are exhausted. Some of them are exhausted with a lot of a lot of issues, so they are not happy. When you ask them what is the issue, they can't even explain. Then they have there is one that is not that real, but some women experience that. That is postpartum psychosis. You notice that some women after giving birth, it disrupts their sense of reality. So, but the good news that it is treatable. It is treatable. But once there's any changes like that, it's good that the person they take the person to the hospital for proper. Yes. Then we have memory. Some people that used to have memory loss. Everybody, every mother passed through that. Even me as a mother, I remember those days after I'll keep something, I'll be looking for it. I'll be asking, where is my phone? Where is my this? So it's just forgetfulness. You can easily forget something. So it's part of it. Then loss of identity. Some mother, some postpartum moms after delivery, they notice that their mental issues will not be somehow, you not able to look at how I'm sad. I cannot go for this again. I cannot go for, they lost their identity. Some of them said they might just decide to resign from their job in order for them to, take proper care of
Yeah.
themselves. So these are the
Yes, you're
emotional and
right.
mental changes that can easily happen. Thank you.
Yeah, right. I'm really glad you talked about this because people don't always see the emotional side, the mood swings, the feeling overwhelmed, or even feeling low does not mean a woman is weak. It means, like our guest said, it means that she needs support, she needs rest and understanding. So thank you so much for that wonderful contribution. So my number four question. How can a mother differentiate between normal emotional changes and something more serious that needs medical attention? How can a mother differentiate between normal emotion or emotional changes and something that is more serious that needs medical attention?
Okay, thank you.
Yes.
All these things I mentioned earlier, usually some women pass through them naturally for like 3 weeks. They pass through it naturally for like 2 weeks, then it's live. But if after like a month and the woman is still crying, that means it's not a normal thing again. That person must be passing through some mental or psychological issues that needs to be addressed. So if you see the woman trying to harm the child, it calls for medical attention. And such woman should be placed on antidepressants so that she doesn't harm the baby. So all these things are common things you can easily notice. Then when you see a woman refusing to breastfeed the child or feed the child without any physical reason, you usually see a lot. You see some people say they don't want to feed their child, they don't want to get. What is the issue? They don't have
Yes.
any, but it's just,
Any reason for
they
that?
have seen,
Yes.
yes, I've seen some that wants to kill themselves. That means they feel like they are tired, all these things. In fact, there's one scenario that happened that one wants to jump. But like, what is the issue? She can't even explain. When that everything is exhausted, they are exhausted with a lot of stress. So this calls for medical attention. Thank you.
All right. So, thank you so much for that wonderful point. So, what our guest is trying to let us know is that seeking help is very powerful, and speaking up is not a sign of failure. It's actually strength, and no mother should suffer in silence. So, thank you so much for that wonderful contribution. So, for my fifth question, what role does nutrition and rest play in postpartum healing? What role does nutrition and rest play in postpartum healing?
Okay, thank you. And nutrition plays a vital role in the sense that I think that was the main reason why Mugo is invested so that
Mm,
mothers can easily come to see their daughter when they teach them. But recently the reverse is the case. Some people come, they come with sickness, they come with a lot. Then the person that's supposed to be cared for will not be cared for again. Then they start running around taking care of the mother that comes from the village. So ideally, I'm not just supposed to take care of the woman nutrition and
Yes,
breast,
exactly.
but
Exactly.
yes, but now a woman has, because a woman has lost a lot during delivery. Has lost blood, she has lost milk, she has lost electrolytes, nutrients, and she needs to get it back for herself through good nutrition. So I think in fact, if a woman gives birth, it's better someone is close by to take care of her. And I think secondly,
Yes.
a woman usually feels exhausted. So so when they go to like this, there are some kinds of lack of energy. So she doesn't need stress again. So you know that a woman is also breastfeeding a child. So she needs to eat well for her to produce quality
Yes.
breast milk.
Exactly.
Yeah,
Exactly.
she needs to feed well. So when she doesn't feed well, she won't produce enough breast milk. So it is advisable that when a woman is passing through all this, there's need for actual nutrition. Nutrition that contains the balanced diet. Then we talk about rest. A woman needs rest for her body to recover. So we talk about sleep. As she sleeps well, her body recovers. When she doesn't sleep well and the baby stress and all this, you notice that the woman won't be fine. So that kind of frustration is what can trigger all these mental issues. So it is important that that the woman rests very well so that she can produce quality breastfeeding for her baby. Oh yes, thank you.
Okay, thank you so much. So, every mothers out there, we need care. They need good food and enough fluids and sleep, most especially sleep. And so, because these are parts of treatment and recovery. So, thank you so much. So, my sixth question: how can partners, family members, and the community support a woman after childbirth?
Okay.
How can
And
partners, family
family
members,
members,
and community?
family members, partners can support their
Oh, the network is bad.
a woman
I can
a
hear you
family
now.
can be.
I think,
Can
I'm
you hear
sorry, ma.
me?
Can you start from that the contribution
Okay,
again? Because the network,
okay.
yes, ma.
Uh, how can partners and family members support their health? They can support the woman after childbirth through, they can support in terms of nutrition. Yes, they can support in terms of nutrition, making sure that they help the woman to make quality food in order for the woman to be okay. They can provide in terms of physical activity. They can help the woman to run some errands so that the woman won't, then they can provide emotional support when needed.
Yes,
So
yes, ma.
during postpartum period, it is very difficult. It is a very difficult period for mothers anyway. So instead of cooking by themselves, doing house chores, doing
Yeah,
a lot of
have
things.
people around
So
that
it is
assist her in the kitchen.
yeah, you see that they have members around that can teach them about this. So it
Yeah,
is advisable that a mother, a family member, or even a neighbor to always be around a postpartum mother
around
to
her.
know when the
Yes.
birth conflicts. Yes. Thank you.
Oh, thank you so much. So I always say postpartum care is not just for the mother alone. It is a family responsibility.
Yes,
Even small help
yes,
like
it's fine.
assisting, just like our guest said, like assisting with the baby, assisting her with house chores, or simply checking up on her emotionally can make a huge difference. So thank you so much for that wonderful contribution. So my last question, ma, what are the danger signs after delivery that should never be ignored? What are the key danger
Okay,
signs
thank
after
you.
delivery? never be ignored. Okay.
And okay, so when we look at what, okay, no, what we can be looking at for the emotional and mental changes that we talked about, when we look at it, when you see the when you see all those things going extreme, even when you talk about exhaustion, when a woman is too exhausted, it's true that you're exhausted, but at least it's not that for the past 6 months, 7 months, the woman that gave birth can't even look healthy, can't even, to look malnourished, she's looking unkept. No, when you see all this thing, that means something is wrong. So in that
Yes.
case, it's a danger sign that needs medical attention. Then again, it's when she comes for postpartum care, and you're asking her some question, some of them they can't open up before you know. You might ask one or two questions before you know she burst into cry. She tell you that, oh no, this person is passing through this. So in that case, there's a medical attention. Then when you look at the child too, you see a child after 1 month, the child comes for one immunization again, but the child is still looking like a day old baby. That means there's a problem. The mother is not taking this care of the child, so it is good that after all the whole process, maybe it's not a hereditary factor, it's not a normal. That means there's a need for the mother to be taking good care of. And again, you don't ignore heavy bleeding, foul smelling discharge, you don't ignore high fever, severe lower abdominal pain, severe headache,
Well,
chest pain, fever, leg swelling, all these things. Once you notice them, that means it's a danger sign that needs attention. So you have to report back to the clinic.
okay.
Thank you.
All right. Thank you so much, Ma. I really appreciate. Thank you. So I don't know if our guests have any questions. Okay, if there's any question you'd like to ask, please drop on the comment section. So, in essence, what our guest said is that she just explained everything. Now, this is very very important for everyone watching, and not just mothers. When when we know these warning signs, we should act fast and save lives. So, thank you so much. So, I don't know if there's anything you would like to say to our viewers, man. So, you can just say
There's
it.
no more. There's no major thing into it because the whole thing has been said. But it is important that a postpartum mom to always take care of herself. And you mustn't wait when everyone or maybe your family member when they come to complain of one. Once you notice some changes that is that you're passing through, you can speak to your neighbors, your friends, that like this time
Exactly.
around that everything is already digitalized. You can speak to anyone, say, see, what do I do? So that you can seek help. Because a closed mouth is a closed destiny. If you
It's a
close
close
your
destiny,
mouth, you
yes.
say nothing to get so the issue can trigger to a terminal stage that might not be treated well again. So early signs and early treatment is better. Thank you.
All right. Thank you so much for that wonderful contribution. Thank you so much, Ambassador Vivian. So at this point, I want to encourage our viewers. If you are a mother, you are a sister, you are a husband or friend, your support matters. And so drop in a section and drop a comment in. You can drop your question in the comment section if you believe mothers deserve full care after childbirth. So I think there are no questions for now. So, as we round up today's section, postpartum recovery is not just about healing the body, it is about restoring strength, emotions, confidence, and support systems. So, to every mother watching, you are doing better than you think. Give yourself time, ask for help when you need it because you're not alone. And thank you so much once again to our amazing guests for sharing this knowledge with us. And thank you for everyone. Thank you everyone for joining, and please remember to join us every Thursday by 3 p.m. here on YouTube as we continue important conversation around maternal health and well-being. And please don't forget to like, share, comment, and subscribe so more people can learn and support maternal health. See you in our next live section.